Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, Pennsylvania has a new governor. Healthcare and transportation will be huge challenges for the new administration. And by the way, they're the challenges on this program, Pennsylvania Politics, in depth and in detail. And it all starts right now.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
All right, well, we're off of politics on this program for a while, but trust me, not for very long. But look, the new governor is going to have some daunting challenges, two of them that he's going to face immediately. Number one, health care. It's about 25% of the state's budget. Infrastructure, transportation, roads, bridges. We brought some of Pennsylvania's top experts in to help us out, understand what challenges the new administration faces. Sitting across from me, as often is the case, is Dr. Stuart Shapiro. He is president and CEO of the Pennsylvania Healthcare Association. All right, Dr. Shapiro. Wow. Healthcare, new administration, Medicare. We'll get into all of that. You're sitting there, if Governor-elect Corbett were to call Dr. Shapiro and say, okay, healthcare advisor, what advice would you have for the new governor?
I'd say, Mr. Governor, you have to look at and make sure that Medicaid, which consumes better than 21% of the state budget, second biggest expenditure, second education, which is a little bit higher. You have to make sure that every dollar is spent efficiently and effectively. And let me explain what I mean. Efficiently means everything is cost. You look at cost and you make sure you're getting your value received. But equally important is you have to make sure that every dollar spent is spent effectively and you set the right priorities. And then I'd lay out for him a 6-point plan, which we can get into.
Well, I want to get into that. Now, you know, governors can issue edicts and orders, and you know, the Auditor General has done those audits on the welfare program, the public assistance program, cites all this waste efficiency. In fact, the governor-elect talked about those, I think, in his speech, his victory speech. So is that as doable when you say efficient? I mean, isn't it hard to take any big set of institutions and make them more efficient?
Well, let me go into that in a little detail.
Sure.
Let's say you take the Medicaid budget. Let me go through a 6-point plan. The first thing you do is you catalog all the services, and you make sure that the services are being provided are the right services and that they're federally mandated. So you're not picking a bunch of voluntary services, and so many services under Medicaid that are not required by federal law were expanded under the Rendell administration. Billions of dollars worth of unnecessary, or they're good services, and they provide valued services, but are they, given the constraints of the budget, are they the right services? That's one. So you catalog them and you look at them. Secondly, you reform payment. Right now, whether it be hospitals or nursing homes or any other healthcare services, they're paying a variety of prices for the identical service. So set the quality, sets the standards, pay the same amount of money for the same services. So you catalog, you reform payment. Then you standardize evaluations, whether that's in long care or acute care, so that the same standards of what kind of care you're providing are there. You're already beginning to cut back into areas of standardization, so it's not all over the place.
Before you go on to the other three, if I think you got the three there, is this because the healthcare system grew like any other institution and organization, sort of topsy-turvy, new rules, new regulations, not re-evaluating and reviewing what it did how it performed its services in the past? It just sort of grew.
It grew, and there are a small amount of standards. Example, someone on Medicaid goes into an emergency room at one hospital. They may be admitted. They go into an emergency room in another hospital. Doctor may say you can take some medicine at home. We ought to standardize that so that people are getting quality services. We set the standards, but that they're not all over the place.
I want to get, we're going to run to a break. Before you get to the other three, and we'll do that in the next segment, I want to ask you another question. But overall, I mean, you raised this quality issue. Overall, how would you rate in general the healthcare system in our state, the hospitals and the pretty good, right?
Well, I've been a member of that, and I can tell you that Pennsylvania has the finest healthcare system in the country. Whether it be, now not every rural city has that, every rural town, but you have access to, through systems that are there, to the best healthcare in Pennsylvania. Let there be no doubt about that.
Well, all the surveys that have been done, by the way, illustrate just that. That by and large, consumers are happy with their physicians, are happy with their access, and they're happy with their quality. It could undergo some change. All right, you're getting in here first with Dr. Stuart Shapiro. We're going to get into other ways, good advice for the new Corbett administration. We'll be back following these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is presented by PAConstructionJobs.com. For more information about rewarding careers in the highway construction industry, visit PAConstructionJobs.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back. We're giving some advice on this program to Governor-elect Corbett, like he's not going to get enough advice, right, Dr. Ship? Everybody's going to be giving him advice, but in this case, we've got a couple of the state's leading experts sitting in front of me, Dr. Shapiro on health care, coming up, Bob Latham on infrastructure, transportation, roads and bridges. We'll get into that with him. All right, we were talking about, let's continue with your list. You have a couple of more items that you want to...
I said first I'd catalog services and eliminate a non-mandate. Then we'd reform payment to make sure that the same pay is paid for the same services. Then I'd standardize evaluations and treatments and monitoring. Then I'd move on to going into and making sure you're eliminating any fraud and abuse.
Right.
And the Attorney General, or Governor-elect, has been focused on this intently, and quite rightly so. But we also have to add conflicts to fraud and abuse and conflicts. For example, right now in the long-term care field, certain people assess, certain organizations assess what services an individual ought to receive, and then they provide, sometimes they provide those services. So there's a conflict to refer to yourself. We have to eliminate any self-referral in the healthcare industry. Next, we need to look at, and I think I mentioned this briefly before, reforming payment. Then you need to make sure that the county assistant offices are all very efficient. For anybody who's ever looked at or walked into, there's stacks of paper everywhere. They have so many people doing jobs that could be made much more efficient. And I would think that the governor-elect would want to reform the way county, the county assistant's office work. And finally, and a big issue in health care, and I would hope that the governor-elect takes this on, and I suspect he will, because he's talked about it. And with a Republican House and a Republican Senate, we ought to go right into tort reform and have Pennsylvania finally, in the 21st century, put into law some real tort reform.
And he talked about that during the course of the campaign. So
yes, he did.
That's your reference.
And I can tell you that if you look at the states, the 50 states across the country, the Pennsylvania is probably 47th or 48th in terms of its inadequate tort system.
Let me ask you this question now that you've laid this out. Much of course, the state's fiscal situation is reliant on the federal government. And when you get to health care, we are talking about the activities and the payments by the federal government into a variety of programs, particularly Medicare, Medicaid, which we share. What's your sense about what's going to happen nationally, which could have a huge effect on our state?
Well, first we're going to have a budget hole in 2011-12, in part because the increased federal matching under Medicaid goes away. And that's going to pull out about $2 billion of federal dollars. Then you put all the additional mandates of the Affordable Care Act, or Obamacare, onto the agenda, and it's going to raise expenditures. And I think at a national level, in fact, I hope at a national level, that the new Congress works with the president in a cooperative way to say, let's slow down the implementation of this program until the country can afford it.
So now, if I understand this is pretty important. all this talk about structural deficit, whether it's transportation, which I'll get into with Bob Latham in a minute, or the problem with the pensions and the unemployment you're suggesting here that there will be a $2 billion hole potentially in the Pennsylvania state budget because the Medicaid payments will go away when the stimulus and all of that ends in January, or is this unrelated to that?
The Medicaid payments aren't going to go away. What happens is the federal matching. Right now, in the old days, 2 years ago, every dollar spent by a provider on or by the state on Medicaid was 45 cents from the state government and 55 cents from the federal government. That went up to 66 cents by the federal government, and that difference between 55 and 65
that goes away.
That goes away.
Whoa.
And that is an enormous amount of money.
You know what? You're going to follow this for us, and you'll come back in. I mean, this is a huge deal here. We're talking about when they talk about a potential hole in the Pennsylvania budget, and you know, next spring, guess what? We're going to be here debating the governor's budget. We'll go away for this, but with that reduction, which is the best way to put it, be applicable for the next fiscal year for the Commonwealth.
It gets phased down this fiscal year for the Commonwealth. So it's 65% until the end of this year. For the first 3 months of 2011, it goes down to about 63%. And
then it will
it goes to 63, then 59, and then 55%.
All right, listen, thanks for coming in. You keep us updated, because when we get into next spring, we start talking about the fiscal problems of the state. This could be a huge problem that the state is going to have to confront. There you have it, update on health care, transportation next. Roads and bridges, you got that. We'll see you in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Well, we have Bob Latham. He's Executive VP with Associated Pennsylvania Constructors. He's our go-to guy on transportation issues. All right, Bob, let's pick up for our audience. I want you to start with the overall situation with doing this. I hate the word infrastructure. Nobody knows what that means. Can I say transportation?
Yeah, building roads, transit,
there you go. Roads, bridges. We ride on them and we need them and we use them, right?
That's how we get around.
Okay, brother, go ahead. Start with, give us the overall picture as we speak right now.
Well, Congress is sort of stagnant right now, and of course we've all went through yesterday's or the recent election a week ago, and so one thing that really happened in Washington that most people aren't aware of in Pennsylvania is James Overstar, who was the chairman of the House committee, lost in Minnesota, which means with the reorganization of the House, the leadership in transportation is in big flux in Washington. So anything that's going to happen as far as transportation funding is going to have to happen here in Pennsylvania. The ball game is right here in Harrisburg.
No help from the feds?
I don't see anything happening from the feds for quite some time. And the longer it goes, the more it can get pushed off into the election.
Tell us about the problem here. Give us the dimensions of it.
We have a huge problem, and we always focus on PennDOT's, bridges that are falling down and all this kind of, not falling down, but in bad shape and need to be repaired. But our local governments handle about 77,000 miles of road in the Commonwealth, and they pay for that out of property taxes and local taxes. They need help too. Our transit systems, not just in Philadelphia and Pittsburgh, but across the state, need capital money as well. So basically, it's the same thing as we have not taken care of the roof of the house. We need to fix the roof, and we need to get on it right away. We do not have the luxury of waiting like some states have done.
Okay, so we have this huge number of roads, 7,000 miles of them in some need of repair. Do I got that number right, or give me the right number?
That's a ballpark number. But really what we have is we have a large system in Pennsylvania. We have 40-some thousand miles of state road. We have 25,000 bridges. They're old. They need to be repaired.
Yep.
But the key that we keep forgetting in that is we have a future where there's going to be growth in traffic and growth in travel, just by growth in population. And we need to accommodate that, and we don't have any plan to do that. We need to widen our interstates. We need to provide more rail.
Good point.
And we need to provide better public transportation in the urban areas.
And I like to relate this to the needs of a modern economy, because I think folks will understand that if we want to grow businesses and keep businesses here, we've got to make sure we have, I hate the word infrastructure, but a transportation network that accommodates that. And we've seen a lot of road work done, and sometimes we sit in the traffic and go, oh no, I got this delay, I think most people, go ahead.
You're absolutely right. I mean, I looked at a survey recently of the office industrial park people, and they say, what are the key things that you look at for site location for businesses? Transportation facility, access to highways is number 3. It's much higher than even the tax structure. You know, you hear a lot of people say, well, we got to address the tax structure to create jobs. Companies locate because of their access to transportation. That's what will create jobs.
And we're asking local governments already strapped to pay not just for what we call their essential services, but also to deal with the road. 77,000 miles, did you say?
Yes, exactly. And that's another key point, is if we provide funding for locals for their infrastructure or their transportation, when somebody comes into a local community and says, I'd like to locate a factory here or a shopping center or something like that, right now what happens is the locals look at them and go, not only do we not have money to provide any infrastructure for you, we want you to fund these other projects down there that we don't have money for. So they drive them away as opposed to enticing them in.
All right, we're going to go to the state problem and how much money the state needs and what Bob Latham thinks the new governor ought to do about it following these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, we're back with Bob Latham. We're talking about roads, bridges, and mass transit, probably one of the 3 or 4 essential conditions that the new governor is going to have to address. All right, put a dollar figure on what you all think needs to go into roads, bridges, and mass transit to get our system to remotely close to where it should be.
In order to have a comprehensive solution, I guess is what we keep calling it, we got to get north of $2.5 billion. Now that's money for local governments. That's a significant boost for local governments, about $500 million a year. About $1 billion a year or more for PennDOT to upgrade its system, and then an equal amount of money for public transit infrastructure. The bridges that carry the trains to SEPTA, Port Authority in Pittsburgh, and also things like rural shared ride in the non-urban areas. People can be prisoners in their own homes if there's no rural shared ride transit program. So that's very important. And we have to look at alternative transportation like bicycling and things like that as well. So we've got a broad-based system that
we didn't even get into the problem that could be created with the Marcellus Shale situation, where all of a sudden we're getting a lot more traffic on and with vehicles that many of those roads were not.
Certainly anything that gets funded through this Marcellus Shale, either severance tax or other things there, or whether the industry does it themselves, they will have to rebuild those local roads. They're putting
so you don't
very
want
heavy
that
truck.
problem added to the general problem. You would have
that would be on top of this.
Yeah,
absolutely. That would be on top of this. The Transportation Advisory Committee has identified a number of about $3.5 billion, but.
Wow.
Governor-elect Corbett has pledged to create a working group, not a study group, here in the interim, and to find a solution to this in the first 6 months of his administration. So we're very optimistic that he has this on his radar screen. This is going to be a top priority, and we're looking forward to seeing that working group formed and getting its act together. The Senate leadership the same way. They pledged to move something early on as well. This is a solution. The election, I think, showed that people want solutions. They threw the people that were, the throw out the bums mentality. I think that what the message was, people are sick of Congress and the state legislature that really didn't accomplish anything. They want to see solutions to problems. This is a problem that needs to be solved.
And so, I mean, are there any sort of solutions that you think are kind of so apparent that they'll be put on the table for consideration? Not suggesting they'll do that, but as an expert, that seem likely to be considered by the study group?
Well, there's a lot of talk about reforms, and certainly some reforms should be added to the process. But we can't sit around and wait for ourselves to study and see whether PennDOT's efficient or not. We know they're efficient. They got the stimulus money out. We're not Virginia. We can't sit around and study. We don't have a big-ticket project like a tunnel under the Hudson River to cancel, like Governor Christie, which was basically a symbolic measure. He hasn't done anything in New Jersey for transportation. We don't have those luxuries. We have several options. We can take the state police money, this $500 million that's now going into coming out of the motor license fund, put that in the general fund. Well, now you've heard in earlier shows about the problem with the general fund deficit, so you just added more to that deficit. So that's a kind of an issue. We have a funding mechanism in the oil company franchise tax that has not been adjusted for inflation since it was enacted in 1982. You make inflation adjustments, and that will drive more revenue. There are certain specific fees, user fees, that can be looked at as well. I mean, we can't efficiency our way out of this. We are going to have to look at some revenue measures.
So in the 30 seconds we have left, so your point is that there are potential solutions out there, that this is a huge problem that just simply has to be dealt with, or not only will the citizens suffer in their daily lives, but the economy as a whole will suffer.
Right. Well, and I'd like to make it even a more positive discussion here, and that is we will create jobs by doing this, not just in construction, but across the economy.
Good point to end. All right. As always, thanks for watching Pennsylvania Newsmakers, and stay well.